Just give me a clap. Perfect.
I go to a doctor because something is happening to me that I don't understand, and I'm hoping that they will help me find an answer. I'd had a number of miscarriages. My husband and I went in to see a female OBGYN to get an assessment. And without even looking at me, she looks down, she says, so I see from your medical records that you're an habitual aborter. All I wanted was to have a baby. And this woman had just, as far as I was concerned, as far as what it felt like, she called me a name.
It costs a lot, right, to go into IVF, to go into the process, especially for same-sex couples to have a baby. And when we were discussing, financially how we were going to afford this, they said, yeah, it's difficult for same-sex couples. You probably won't get any reimbursement, but you can try to write a letter, the both of you, saying that you have been trying for over a year with a man. We were totally shocked and we said, you're asking me to lie. Is that morally right? Is that something that you really want same-sex couples to go through?
When I was experiencing a crisis and looking for care, I was brought involuntarily to a clinic. I was interviewed finally by this one healthcare provider, and they asked me, how could someone like you be depressed? That in itself brought my entire treatment to a stop, because all I wanted to do was honestly leave.
When I was pregnant with my second child, I had suffered severe morning sickness. I was almost unconscious. I guess I was so dehydrated. So they brought me to the hospital. They put me in a room. The doctor walked in and I explained, that I'm 3 months pregnant, I have severe morning sickness, and now I think I have stomach flu. The first thing that the doctor asked me was, are you sure you haven't been drinking? I just finished saying that I was pregnant, so why would I be drinking?
Back in 2016 is when I first got diagnosed with ADHD. When I went into one particular pharmacy that was a part of their network to find out if I can be able to get my medication, they immediately said, yeah, we don't really have it. And I was confused, so I went into my car, I put on my white coat, so put my glasses on, like I dressed up. Once I came in there with my white coat, they're like, oh, hey, you're in pharmacy school. Okay, how can I be able to help you? It's the same guy. I gave him my my prescription, and he starts filling my prescription.
When I was in high school, my eczema had went from mild to severe, and I just didn't know what was going on. So I went to the dermatologist. I was trying to ask him questions, but he was talking very fast. He looked at my skin. He was like, oh yeah, that's just eczema. But I'm like, this is different, because for the first time, like the steroid creams, the ointments, they're not working. So when I came to him for the answers, which, I was like, you're a dermatologist, you should have all the answers, which is what I thought in my mind, but he couldn't give me an answer to that. It made me leave the appointment even more hopeless than I entered. I haven't been to a dermatologist since, and that was like over 10 years ago.
That experience made me feel like he was questioning my integrity. Yes, Native American people, Indigenous people have been struggling with substance abuse due to intergenerational traumas and disparity and poverty, but that doesn't mean we all are. So I just wanted him to see me for me and not judge me based on my community.
It's almost as if I was written off before given a chance to even, take a look at what it is that I need. So I felt like I was failed as a patient.
I really felt like this person wasn't listening, wasn't here to help me, but to judge me. And that hurt a lot. It's hard to think that you need to be such a monotonous or homogenous person in front of someone that you're seeking care from.
I avoid actually going to the doctor if I don't have to, which is not a great idea. But because you've built up that mistrust, you'll defer something possibly quite important that needs to be dealt with.
In those circumstances, you're pretty vulnerable when you're seeing a doctor. Taking the time to really listen to people, and the most important is that you treat me like a human being with feelings. That, to me, that's really positive. That's the way it should be when you see your doctor.
When you walk into a healthcare facility, there needs to be gender inclusive language on forms. It's not including you. You know, you're no longer an individual in a way. You're like, you don't fit in that box. How can we change it? It's, the healthcare facilities talking to the insurance companies and, advocating for real change.
I would love for them to see me as more than my condition. When they walk into the room, you ask me how I, the person, am doing. Yes, I have eczema, but I'm Jennifer first.
I mean, isn't that why we get into healthcare, is to serve and help others? So you need to do just that.
Check your bias. That is a major thing. I know we're in a high stress environment, but if you don't slow down to see what the patient needs, you're gonna miss so much in between.
I still feel like, doctors, dermatologists, they're very knowledgeable, but patients are also too, because they go through this daily. So for them to make the choice with me when we're deciding what we're gonna do regarding my health. So being a part of that decision making is like super important, because it means you're listening. It means you've heard what I said, you're taking it into consideration, and you're not just trying to get me out of the office.
You to kind of remind yourself is that I'm doing this for the patient, and I need to ensure that I'm not writing them off before giving them a chance.
See a patient as just another human, as a fellow pharmacist, as a fellow healthcare provider. We owe that to society. We owe that to that person.
And cut!